Okay, here's the bottom line. You want to stimulate the economy, you want to create new jobs, you want to build an industrial infrastructure that works and IT infrastructure that works, you want to build a nation that works, we need a national health care program. It's that simple. Every other industrialized country in the world gets it. Every other industrialized country in the world has it. It's very straightforward stuff. You can't have a plant grow without good soil for its roots. The roots of our economy, the need to be rooted in the soil of a national health care program, and the other parts of the commons, the intellectual, the physical, and the human commons that makes everything else work. You want to make American business competitive? Get a national health care system. You want to make it more possible for small businesses to start so that people feel like they can go out and be entrepreneurial and take a risk? Have a national health care system. You want to have a healthier populace so that they're more productive, so that you can get more, well, to be crass about it, more work out of your workers? Have a national health care system. You want to have a happier populace. You want to have people who are not waking up in the middle of the night scared to death that they're going to lose everything because somebody in their family got sick and they can't pay their bills. Have a national health care system. This is not rocket science. This is straightforward stuff. It may well be the most effective way to stimulate the economy because it is the most important of the structural and infrastructure. Infrastructure isn't just bridges and roads. This is the human infrastructure of the country. One of the most important infrastructure items would be a national health care system. Obviously, we need bridges. Obviously, we need people to have free college education. These are pieces of that, roads, mass transit, light rail, all these kinds of things. But none of it really works sufficiently without a single payer or a national health care system. My own personal preference is a single payer health care system. Others have suggested over the years a few variations on that. One is to fund so that every state can do their own however they want to do it. Just make sure that everybody in that state is covered. And then you've got 50 incubators to figure out what's the most effective way to do it. But the bottom line is private, for-profit health insurance companies are leeches on the backs of this nation. They are sucking the blood out of our country. For every $100 in health care expenses that goes through the hands of the government programs, the socialized medicine program we have called the Veterans Administration, or the single-payer national health care system we have called Medicare, for every $100 that goes through those systems, about $3 is the total cost of administration. Because you have civil servants, wearing their green eye shades and looking carefully at the numbers, and they got a good pension and a decent pay, but they're not making $100 million a year, and they don't have to pay dividends, stockholders' dividends, and they don't have gold-plated faucets in the restroom in the corporate jet, and they don't have to pay for an army of salespeople out there, and they don't have to buy legislators and spend billions of dollars lobbying and advertising and promoting. None of that stuff is in there because it doesn't have to be in there, because it has nothing to do with delivering health care. So the bottom line, you want to have a country that works, have a national single-payer health care system. It works. It works all over the world. There's a lot of different ways to skin this cat, but they all get back to this one item, and that is get the for-profit companies out of the core of health care. Yes, in most other countries you have some for-profit insurance companies. In many cases what they do is they serve the very rich. If you want plastic surgery, things like that. That's fine. Let them stick around. But for the average working American, this is something that, much like Social Security, this is something that should be part of the commons. This is something that we all should be working on. Now, Congressman John Conyers has proposed House Resolution 676 that would do just this, give us a national health care system. He has proposed this several years in a row now, and in fact, it was co-sponsored by 93 members of Congress last year, including the number 3 guy in the House of Representatives, number 3 Democrat in the House of Representatives, Congressman James Clyburn, who, by the way, is a very good guy. He's a very good guy. He's a good friend of Bernie Sanders. In fact, he worked with Bernie on quadrupling the number of community health centers in the United States last year and the year before. He's done some great work. And in an interview with C-SPAN a couple of days ago, I guess it was last Sunday, he was talking about this issue and seemed to suggest that maybe, we shouldn't just, bite off the whole, well, his phrase is that incrementalism might be better than to go out and just bite off something you can't chew. I think we can chew this. But the fact of the matter is that no politician, including Congressman Clyburn, the good guys, can't do it if they don't know that we've got their back, that we're going to go out there and work as hard as we can to help them be successful, that if they stick their necks out, the Republicans aren't going to chop it off and we're just going to stand back and twiddle our thumbs. They need to know that we're here. So today, and not just today, but on an ongoing basis, but let's kick this off today. Give your A, call your member of Congress, B, call Congressman Clyburn's office and say, Congressman Clyburn, thank you for the great work you've done in health care in this country over the years and all your great years of work and service in the United States House of Representatives. And please do everything you can to support right now in this legislative session as soon as possible, while we still have, momentum and Obama still has political capital, to support a national health care system like John Conyers' House Resolution 676 or some variation thereof. Let's get this topic on the floor of the House. And James Clyburn is the number 3 guy in the House. He is the Democratic whip, and this is just so important. Or the House Majority Whip, excuse me. Well, yeah, it's the Democratic whip, and this is just so important. So you can call Congressman Clyburn. Actually, you can call any member of Congress. You go to callcongress.org. It'll take you to a page on my website, ThomHartmann.com, where we've compiled a list of 800 numbers, toll-free numbers, that will get you to the switchboard in Washington, D.C. They just answer, hey, it's the Capitol, and you say, I'd like to speak to Congressman Clyburn's office, please. Or I'd like to speak to, in my case, here in Portland, it might be, Congressman DeFazio's office, or in Oregon, or Congressman Blumenauer's office, or, whatever. You ask for your member of Congress, and by the way, I don't fail also to ask for your 2 senators. Every state except the District of Columbia, of course, has 2 senators. So call both your senators, even if they're Republicans. They need to know that you're there. They need to know that we're here. And let's call for a national health care program. This is pretty straightforward stuff. The Nation had a great article by John Nichols, who's also, along with me, a member of the advisory board for Progressive Democrats of America, pdamerica.org, by the way, after downingstreet.org and PD America, Progressive Democrats of America. Check it out. John Nichols writes this piece. He says, a national health care system. He's quoting a study by Jerry Jenkins. This is the study that the National Nurses Organizing Committee of the California Nurses Association put forward. That a national health care system would create 2.6 million new permanent good-paying jobs that are not easily shipped overseas. It would boost the economy by $317 billion. It would infuse public budgets with $44 billion in new tax revenues. Congressman Conyers has called for this, House Resolution 676, his single-payer health care bill. Let's get behind this thing. CalNurses.org, by the way, the California Nurses Association. And that's a good one. PDAmerica.org, you can find out more information, Progressive Democrats of America. But this is important. This is the time. Yeah, it's 10 days in. Barack Obama's only been in office 10 days, and he's done a lot, and he's doing a lot. And if he really wants to have a stimulus of the economy, clearly there's a number of things that need to be done. This infrastructure package, I'd like to see aid to higher education. I would love to see a program where everybody can go to college for free in the United States if they're inclined, and also to trade schools for free for those who are inclined to go in that direction rather than college. There's a lot of just fundamental things that need to be done. National health care and a national transportation system, light rail, a lot of that is actually built in the stimulus package. But a national health care program is stimulus. It is infrastructure. In the Declaration of Independence, Thomas Jefferson wrote about life, liberty, and the pursuit of happiness. These are the core core values. These are the core rights that the founders believed we had. How can you have the right to life if you don't have access to health care when you're sick? I mean, it's really that simple. So go to callcongress.org, or you can try Congressman Clyburn's office, 202-225-3315. We'll be right back with your calls.